What's up, everybody? You are listening to the Strength and Knowledge Podcast. I'm Dr. Zach Baker, and I have with me today Dr. Asher Roberts, one of our two sports residents, who operates out of our Frederick location with the R2P Sports Residency. Part of the residency is to do journal article reviews on a monthly basis. Each month has a different theme. The month of January is the hip, and Asher picked an article regarding hip arthroscopies and golf. And admittedly, I'm not a golfer. Played a lot of sports growing up. I continue to try to be as active as I can with it. I think I have played a total of 2 rounds of golf in my entire life. And when I say playing golf, it's a very loosely used term. I was on the course swinging a club, occasionally hitting the ball. So, Asher, if you don't mind, tell us the article that you chose and really what the intention of it was.
Yeah, so the article is called Return to Golf After Hip Arthroscopy, a systematic review of the literature. So I kind of picked this background because in my early PT student career, I did a lot of my rotations and exposure in South Carolina. South Carolina, you get a lot of retirees working in a lot of different communities down there, and golf is pretty big. So picked up that as a hobby kind of in college and PT school. Admittedly, I am nowhere near a good golfer. You and I could probably be pretty competitive on the course. But I thought it would be interesting because I did get some questions when I was a PT student of, my hip hurts with my golf swing. Do you know if surgery would help me be able to come back and golf better? So when I found this article, I was like, let's take a deep dive into this. As a therapist working up here, I don't tend to meet a lot of golfers, but in general, you're going to come across it. It's a growing sport with people aging, and knowing kind of recommendations to give patients on recovery timelines, what to expect after surgery is going to be important in the clinic.
Cool. And it looks like this article was a systematic review. Several years ago, I was tasked with doing a lecture on return to sport in general after FAI and other hip arthroscopy procedures. And at that time, it was relatively inconclusive. There were different articles that were out there that talked on the topic, but there wasn't a lot of conclusion in regards to ideal rehab program, ideal timelines, just because there was so much variability in timelines with returning to sport and return to sport testing. So when I saw that you took this one, and it's a little bit more specific to golf, I was curious to see just has anything changed over the last couple of years with regards to the literature, or is there anything unique to the sport of golf? And Asher, I'm going to let you just kind of roll through the article. If you can let us know who was involved from a patient population standpoint, what were the things that they were trying to measure, and what were their methods for measuring all of this? And then ultimately, what results did they find? And after that, you and I will kind of go back and forth in regards to what we think this means for clinicians.
Yeah, so it is kind of funny that you bring up that things were kind of inconclusive when you were looking over stuff, because this article actually looked over 400 different articles and ended up settling on 4 that they could actually use in the study. So not a lot has changed, but we do have some kind of things that we can look over here. So this article basically looked at both professional and amateur golfers. If you add up the total amount of hips that were operated on, we're looking at 96 different hips here. They were looking basically at different outcome measures. The HOS-ADL, the Hip Outcome Score for Activities of Daily Living. The HOSSS, Hip Outcome Score for Sport-Specific Subscale. And then your more typical Harris Hip Scale and just visual analog pain scale. Interestingly, one of the articles looked at golf performance. So they were looking at 2 metrics there, percentage of greens in regulation, just how accurate are you, and then average drive distance, how far can you hit the ball. Pretty decent follow-up. They followed up with patients on an average of about 6 months post-op, but some looked up to 3 to 4 years. So out of the 4 articles they used, seems like there's some pretty valid information that we can use to draw some conclusions. First big takeaway that I got from these articles is these golfers' hips were messed up. If you look at the type of surgeries that were done, 57 of the 96 hips had a labral repair, 39 different hips had labral debridement, 69 hips had acetabular rim trimming, 73 had a femoral osteochondroplasty, 18 received just a regular chondroplasty, and 7 had microfractures. So a lot of stuff going on with these hips, which covers a lot of bases with some of the injuries that patients will report seeing on their imaging whenever they get their hips imaged. Looking at the outcomes for return to golf, 90 out of the 95 golfers returned to golf successfully. 100% of the professionals returned. 64 out of the 69 amateurs returned. One of those amateurs said that they didn't want to come back because they didn't want to risk re-injuring their hip, and unfortunately we don't have information on the other 4. But we can kind of draw conclusions that if you're a pretty high-level golfer, your chances of returning to sport are pretty high. As far as golf performance goes, there was like a 1% change in percentage of greens in regulation. It kind of makes sense. Golf is, I'm sure as you've experienced swinging a golf club, it's kind of hard to be accurate in golf in general, and having a cleaner swing sometimes won't entirely help you with that. But there was a pretty significant increase in drive distance, and by significant, I mean about 10 yards. So, which kind of tracks, you know. If you're having a more comfortable swing, you might be able to put a little more power into things, get the ball a little bit farther. Let's see. Their biggest conclusion as far as recommendations for us was more in like the rehab protocols. We at R2P kind of do a multi-phase rehab where early on you're focusing more on restoring range of motion, restoring strength, and eventually progressing more into your sport-specific training. That's what they recommend here, which is kind of good to see. And then they also gave recommendations on just more nuanced things like swing progression. Like you should start off putting first, and then you should swing on artificial turf before you actually get into chunking it in the grass and things like that.
So pretty interesting. I was, I don't want to say shocked, but surprised at just how many people were able to return to sport. And I think that speaks to 2 different things. Probably the success that we're having with hip arthroscopy procedures. Mm-hmm. And there's something that we feel much more confident doing now within the medical field, and also with the rehab side of things, between better, more efficient surgeries, better, more efficient rehab programs. We are seeing very, very good outcomes. 100% of your professional golfers returned. A large majority of your amateur golfers returned as well. And I think that also speaks to the sport of golf itself and your ability to modify pace of play, modify your approach. Hey, am I going for the long ball today? Am I going to be a little bit more strategic and play more of a short game? So I do think that is a good conversation that you can have with individuals as well when they're getting into that later phase of rehab. They want to get back onto the golf course. It's not necessarily an all or nothing deal. It's not like they're going out on a rugby field or a football field where you really only have one option of going 100% all the time. Golf does provide you with that ability to self-regulate your overall, quote-unquote, intensity of which you're playing with and your style of play.
Definitely.
When you look at this article, what were some things that you will take away either with your clinical approach to patients or just keeping in the back of your mind as you're working through plans of care or speaking and talking with patients?
I would say my biggest takeaway is kind of on the patient education side. A lot of times patients are coming to you first before they get surgery when they're having some kind of hip issue with their golf game. And if they're having questions about like, hey, should I do this surgery? Like, what would be my outcomes afterwards? Being able to give them some more kind of concrete answers. Being like, hey, there's some research that shows that you have a pretty strong likelihood of returning at kind of the same or even better than before surgery. And then just walking them through kind of timelines. Like average timeline was about 4.7 months for return to sport. So you can kind of give them some expectations there on just what to expect. And then educating them eventually post-op on, hey, how do I actually return to swinging the golf club safely and effectively?
Awesome. Now, with this, as we start working through phases of rehab with our golfers, I think it still is important to golf is unlike any other sport, or just like any other sport, where there are some things that we can introduce in a graded fashion. Mm-hmm. With our basketball players, there's a difference between ball handling drills, stationary ball handling drills, shooting foul shots, and playing a full-on scrimmage. So when I have individuals that they come off of a hip surgery and they're a basketball player. When we say, hey, you're returning to sport, 5, 6, 7, 8 months later, whatever the protocol and the rehab process entails, it doesn't mean that they're doing absolutely nothing basketball-oriented until that final day of rehab, and now magically they're doing everything. Now, that's somebody who is getting a ball in their hands earlier on in the rehab process, and they're finding ways to do very low-intensity, low-impact drills that aren't compromising the surgery, but are making them feel active again. Same thing from a golf standpoint. We talk about these return-to-play timelines as, that potentially 4.5-month mark based off what they found with this cluster of participants. But I'd like to think there are things that they can do earlier on. I don't think there's anything wrong with putting earlier than 4.5 months out. There's a difference between putting and chipping and driving. So, Asher, if you're thinking about early phase rehab with somebody who has a hip arthroscopy, and we're speaking in general terms because we don't know, did this include a microfracture? Was it a labor repair? Was it just a debridement? But if you have a golfer in early phase rehab, as a clinician, what are your focal points that you're looking to achieve?
Big thing early on, and this is just going to be the general focus of the rehab, is getting that range of motion. The golf swing, you have heavy external rotation and heavy internal rotation happening on both hips. So really early on, you're going to be focused on getting that rotational motion back. And then as you progress is going to be just kind of strengthening in that range of motion and building good motor control throughout that kind of like hip, core, shoulder separation with that golf swing. Like you said, putting early on is a really great way to get golfers kind of bought in and doing stuff they like in the clinic, and then eventually progressing them farther down into those swings.
Definitely. When we think early phase rehab, I call this the don't screw things up phase. Let the surgery heal, keep them in a protective environment that's facilitating healing. You're doing progressive range of motion, you're managing symptoms, and you're focusing on just really tunnel vision of that hip joint. The things that are impairments, we are working on putting those pieces back together, getting them to work optimally while we're allowing that area to heal. As we get into more of our mid-phase, we start to look a little bit more broad. The hip should be trending in the right direction. We may not have perfect range of motion, but we have pretty good range of motion. We've got good isolated muscle control. We're starting to restore strength in isolated motions and planes of movement. Now we start integrating things. And it doesn't mean we're doing high intensity. It doesn't mean we're doing high resistance or high velocity. But we start to integrate those hip movements with more compound movements or multi-joint movements of the lower extremity. We start incorporating lumbopelvic, thoracic movements, and getting into more total body work. And then as we get into that later phase, all of these different movements we've demonstrated competency with, we just progressively make them more demanding, either in regards to volume, intensity, and however you want to quantify intensity. Is that force production? Is it rate of force production? Is it velocity of movement? And then eventually you start working into your more sport-specific tasks. So as with anything, always taking care of the most pressing needs first that are surgical related, making sure that you have a really strong foundation in early phase rehab, make a little bit more broad but not as intense in that mid phase, and then increase intensity as competency and healing allows in those later phases, and then eventually sport specificity. So, Asher, any other parting words on this one, or did we get it all?
I think we hit it all.
Perfect. As always, Asher, thanks for doing the dirty work on these research article reviews for us and the listeners. If you enjoyed this episode, please share, like, and subscribe. You are listening to the Strength and Knowledge Podcast. I'm Dr. Zach Baker. This is Tyler Asher. Thank you for listening.